as we mentioned, there's huge concern over the growing numbers of coronavirus right here in Israel, but also around the world, with healthcare professionals alerting governments that these restrictions may, in fact, not be enough. And for more on this, let's now bring in Professor Alon Moses, who's from the Department of Clinical Microbiology and Infectious Diseases at Hadassah Medical Center. Professor, lovely to have you on this morning. Thank you so much for joining me. As I just mentioned,
nice to talk to you.
As I just mentioned, a lot of medical professionals are saying that these countries, even here in Israel, are on the brink of being out of control. But we really are not seeing too much coming from the health ministry. What is your professional opinion on these growing numbers and what the health ministry is doing here?
I think that we are misleaded by the fact that the new cases we're seeing are young people mostly, and that gives a false sense of security that the number of cases that we're seeing does not involve an increase in the number of ventilated patients, those who are put on an artificial ventilation. But we do see over the last few days that there is an increase in the severely ill patients. So I think that as a rule, we are now seeing younger patients. The elderly are staying home and are less infected. So this fact, as I said, gives us a false sense of security that the patients will not be sick. But we are definitely seeing that there's an increase in the severely ill patients. And I expect that within a few days, we will see an increase in the ventilated patients. And, you know, if the young are infected, eventually the more elderly will also be infected. And among the young who are infected, we can also see patients who are with risk factors, and they will become more severe cases. So I think we should now be extremely alert. We should now use everything that we can to try and lower the number of cases. There's a very simple way, just put your masks on. I think this is a very basic way of preventing transmission of the infection. The corona departments in the hospitals are being filled up now. So the increase in the number of cases is going to increase the burden on the internal medicine wards and eventually on the intensive care units as well. So I think this is there should be a wake-up call to everyone, including the government. I think one of the missing parts is early identification, early recognition that the positive patients should be notified, their contacts should be found. The epidemiology of the disease is now known, but there are not enough people dealing with contact identification. We know from other countries in the world that the contact identification, early contact identification, massive contact identification is of paramount importance, and that's at the basis of being able to prevent the spread of the infection.
And Professor, we did hear at the beginning of this pandemic a number of healthcare authorities, professionals coming out to say that, you know, at the beginning, if we do in fact see what's being called a second wave, that it could in fact be worse than the beginning when these numbers were climbing. Do you believe that health authorities here in Israel used that 2 months of, say, lockdown to prepare for the flow-on effects of, you know, what people are calling this second wave?
These are two different things. I don't think that the identification of this increase in numbers is necessarily a second wave. I think we're still in the first wave. It has just not disappeared. We changed our behavior, and that's why the number of cases increases. To your specific question, I think that we did not prepare well enough. We should have been much more prepared. There was a lax in our alertness when the number of cases decreased. There was a false sense that the disease is gone. It's enough to look around the world to see that the disease is anything but gone. In the US, there's been in the last 2-3 days, again, an increase in the number of cases more than ever before. The same in other countries, more identification of new cases and more deaths. So we don't need to look far to realize that the disease is not gone. It's going to stay for a long time. And, such things as computerization of the contact identification, using as many people as we can. There are many unemployed people in the population, and these unemployed persons can be used to learn how to do a simple epidemiological survey to find out the contacts. The leadership is not doing enough.
And Professor Moses, tell me, you said just before that you believe that these extra cases could really place a huge burden on Israel's health system. Tell me, can Israel's health system cope?
I don't think we're at the stage of concern that we will not be able to cope. If you look at the number of cases now, but as I said, the increase in the number of cases that can be expected leads to concern. I think that we're not at the point of worrying that the medical facilities will not be able to cope, but you must understand that we've been having 3 difficult months. The intensive care units have had patients all along. The personnel are exhausted. They've been working hard to keep the patients alive, and more and more difficulties are ahead if we don't try and stop and prevent the new cases.
Well, Professor Alon Moses, I think we can both agree that everyone is really hoping for the best here. Thank you so much for coming on and chatting to us.
Thank you.
The World Health Organization says that globally more